Hi there. Today I wanted to come to you and talk to you about what contact tracing is and what the capabilities that we have here at the Union County Health Department. We've heard a lot about contact tracing lately here throughout the nation, and we wanted to tell you how Union County is preparing. So on a day-to-day basis and on an annual basis, here at the Union County Health Department, we have 2 epidemiologists and a communicable disease nurse that normally do what's considered contact tracing. And on an annual basis, we do about 300 investigations to identify contacts. And so we're pretty familiar with the process. But because you've social distanced for us in the last month or 2, we've been able to increase our capacity and be prepared for more cases than we normally have. And so we've increased our capacity here at the Union County Health Department to about 14 trained individuals to be able to do those contact tracing investigations. And so contact tracing is really, it's a process to identify individuals who are at an increased risk of infection due to their exposure to COVID-19. And those individuals who are at increased risk of exposure are people who spent a significant amount of time within 6 feet of an individual who is infected with COVID-19. And so if you maybe just pass someone in the park or who is infected or don't have that really close contact, you're not at a higher risk of becoming infected with COVID-19. So during our contact investigations, what we do is we identify an individual who is infected with COVID-19 and they have a positive laboratory test. And when we identify that person, we would identify also the people who they've spent that significant amount of time with, within 6 feet of them. Normally this is household contacts, people who they live with, people who they work with. So it could be someone who you work right next to, maybe you have a desk right next to them, or you're in lots of meetings with them. It could also be, people that you spend time with outside of work or your household. It could be people you go to church with, people that you exercise with, things like that. And so you're spending that significant amount of time within 6 feet of them. Thankfully, because of our social distancing efforts, you've been able to eliminate 2 really large arms of that contact tracing investigation. And we thank you so much for doing that for us. So really, we're just looking at household contacts, people who you were spending that significant amount of time with. If you're an essential employee, that still could be your people you work with, but it's really mostly just those household contacts, intimate partners, things like that. So what we do is we ask that person who is infected to isolate. So that means remove themselves from having contact with healthy people, and we ask their contacts, those people who spent significant amount of time within 6 feet, to quarantine. And so the individual who is ill will isolate and not spend any more time with people who are healthy, and the people who are quarantined, so they've had that significant amount of time, they'll be spending their time at home, away from others, and not around healthy people. And that's because at any point in time in the 14 weeks after they've been exposed to the sick person, they could start showing symptoms. And we want to reduce the amount of time those people have spent with healthy people to reduce the amount of transmission. So in a normal scenario, we would have lots of people that you come into contact with, and those people would then all be at risk as well of infection. But because we quarantine, there's less people who are now at risk for infection. And so it just limits the amount of people who are really possible to have the possibility of becoming sick. And so this is a scenario that we want to happen, but if you don't practice those things, we could also have a larger situation on our hand. So we really thank you for following the social distancing measures and for giving us that time to increase our capacity here at the Union County Health Department. If you have any questions on COVID-19 or contact tracing and how we're increasing our capacity here, please feel free to give us a call and check out our website for more daily updates. Thanks, guys.